Hi everyone, it's Dr. Huffman. Today we're going to be starting our first series, What to Know Before Beginning Nursing School. In the first series, we're going to have about 3 different topics. The first topic we're going to go over is today. What's the difference between classes that are gen ed, or the classes I take in my prereqs before getting into nursing school, and the difference between nursing school classes? Like, what makes it harder? So let's go ahead and get at it, okay? So the first reason, Bloom's taxonomy. Well, what is that? Bloom's taxonomy is basically a way that we as professors and teachers try to test your knowledge and your understanding of specific content. All right? So Bloom's taxonomy, as you will see, I'm about to show it right here. Very good. It has different levels. Okay, one level begins at the very bottom, and that's remember. Are you able to take information and remember that information? So that's basically, all right, I can remember that 2 plus 2 is 4. You don't have to understand why, you just have to remember that and memorize it. All right, the second level of Bloom's taxonomy is what? It's understand. Now, it's trying to ask you, why is 2 plus 2 4? And how can you get to 4 in a multitude of different ways, right? So we start off with remember, understand. These are the ways in which your gen ed and typical courses before nursing school test you. And that's why things are different. You're expected to understand and remember content. But when you get into nursing school, they add on the other 2 layers on top of that, which is analyze and apply. So are you able to analyze the equation? Are you able to understand it in any other way that it can come at you? Which means 2 plus 2 is no longer an easy equation. It's going to be a division, an exponent. It's going to be in so many different ways that you're still going to have to be able to understand how you got to 4 and analyze that. You're going to have to be able to connect the dots 1, 2, 3 before you actually get to the answer. And this is what makes nursing classes harder. So the first thing that is the difference between gen ed or prereqs and nursing school is Bloom's taxonomy and the level for which you are tested. Okay? Second thing, what's the second thing that makes it harder? Nursing school does not just provide you with lecture classes. No, we also add in labs and a clinical component. And this is what compounds on top of the didactic or the lecture part that makes things a lot harder, because not only are you expected to understand the level of the information that you're getting, but you're also expected to perform at these levels as well. So lab, you'll have a few hours where you'll be expected to perform special skills. You'll be expected to handle certain medical equipment, which can be nerve-wracking, and it's okay. That's why you have lab. But then you add in the clinical component, and that's going to be time that you're going to spend in some type of healthcare setting taking care of patient, and that's going to be that direct one-on-one patient care. So time is just adding up and adding up and adding up. Typically, nursing school requires about 4 to 5 days of you on campus in lab or in clinical. And your clinicals can range anywhere from an 8-hour day to a 12-hour day, or even a 10-hour day, 8, 10, or 12 hours, which is a lot of time. And then when you have your weekends free, then you're trying to play catch up with your family. You're trying to play catch up with the house, with laundry, with all of these things. So it's not necessarily just that nursing school tests you in a different way and that it's harder, but it's a lot of time management, a lot of organization. Now remember, each one of us all have 168 hours in a week. That's not going to change. But what we do at that time is what's going to be the difference between being successful and not being successful. I'm going to do a video series on time management and organization in itself. But let's move on to the third reason that nursing classes are different than gen ed and or your prereqs. And that's the amount of study time that's required for you to study. So Your lecture hours in class, you might have one class that's worth 4 credits or 4 lecture hours, which means if it's worth 4 credits, typically you're going to go to school and you're going to sit in front of your professor or your instructor, and you guys are going to have one-on-one contact and lecture time for about 4 hours. Well, for every one of those 4 hours, every one of those, you are expected to study that content for a minimum of 2 to 3 hours. So for a 4-hour lecture course, you're required to have about a minimum of 12 hours to study just for that one lecture. And that's an every week thing. So think about that. We have lecture, we have lab, we have clinical, and then we have the time to study to make sure that we understand that content. Now, that's one of the main differences. So we're up to 3, okay? Bloom's taxonomy, which is 1, 2, which is the classes added with lab and clinical, and then 3, which is the amount of time that's required to be able to study for these types of lecture. All right, so let's get into the 4th thing. Unfortunately, you can't just come into nursing school and just say, I'm going to study the exact same way that I studied before. It's going to be different. It's going to be about rationales. Rationales are the outcomes and the why of why something works in the way that it works, of why it is the way that it is. So we have to understand why things are normal to be able to understand why things are abnormal. So it's not just a remember and understand, it's the ability to critically think and analyze certain content and components. I know you guys, I just said a word, critically think. And I know a lot of your teachers or a lot of people are saying, man, you need to go ahead and learn how to critically think. Don't worry. I have a series that's going to focus specifically on what critical thinking is, how to get better at it, and why it's so important. All right? Now let's keep going on. The 5th reason that nursing classes are a lot harder than regular gen ed or your prereq courses. The 5th reason is because there is a lot of responsibility you yourself as the student have to take on. If you're expected to be an advocate or a proponent for your patients, you have to be expected to be an advocate for yourself, for your education, which means you have to know what kind of learner you are. Are you an auditory learner? Are you able to listen to things and actually comprehend them from just learning them? Are you a kinesthetic learner, meaning you have to write things, you have to do things with your hands, you have to experience them? Or are you a visual learner? Do you need a PowerPoint? Do you need a video? Do you need multiple outlets and sources? Do you need pictures? Or are you a combination? I'm a combination, right? If you don't know what kind of learner you are, that's absolutely fine. Down below in the description, I have a nice link that's going to send you to a free quiz that's going to teach you what kind of learner you are. And then you're going to be ahead of the pack, all right? And the 6th reason, the very, very last reason that nursing classes are a lot harder than your regular gen ed or your prereq courses is because there's a level of professionalism that is required of you. There is a level of maturity, a level of understanding, a level of being able to be non-judgmental in a world where there is nothing but judgment occurring. Because why? You are going to be in a room with somebody whose life is changing at that moment. They've either never experienced being in a hospital setting or being away from their comforts of their own home, or they are there far too many times and they are maybe hopeless, and you have to go into that room and take care of them. Be non-judgmental. You have to just raise them to another level. And you have to be private. You have to be able to keep a secret. You have to keep those things quiet and respectful. You can't go around telling people about people's intimate moments. Remember, that person is going through something that's changing their lives. Even though you may not know how to deal with that, there are different ways in which we communicate, right? We can smile. Our body language, our facial expressions, the accent in which we either put strong and strength in words, into our words, right? Or we can say things with our inflection, our tone, our ability to have compassion. So that's the sixth thing that makes nursing school a lot harder than our other classes, is because you will be graded on participation and professionalism, your ability to grow and be a mature individual and be non-judgmental. So let's go through those six things that make nursing school different than your regular prereq courses and or your gen ed classes. This is why nursing classes are so hard. One is what? I know you guys remember it. It's Bloom's taxonomy. And I'm going to stick that in just about every video because from day 1 to day 5 million, your NCLEX is going to test you on Bloom's taxonomy as well. All right. So Bloom's taxonomy, you're not being judged or tested. Sorry, the wrong word was judged. I'm human, and that's okay, right? You're not being tested on remember and understand. You're being tested on analyze and apply. Are you able to look at this information and not just remember and regurgitate it, but critically analyze and apply the content in a multiple of different scenarios, in different settings, and in different ways? All right. So Bloom's taxonomy. Number 2 is what? Did you listen? It's the load that you have. You have lecture, you have clinicals, you have lab, and you have to be able to manage your time. Number 3, the hours that you're required to study for each hour that you are one-to-one contact, either in lecture or in lab or even in clinicals. And like we said, lab can range anywhere from 1 hour to about 4 to 5 hours. You can also have simulation in there, and you can also have clinicals, which can range from 8, 10, or 12 hours a day, sometimes twice a week. So Bloom's taxonomy, you're going to have the load and being able to time manage. Number 3 is the hours. For every 1 hour that you are face-to-face, you're required to study about 2 to 3 hours each hour. And that actually increases if you're on the quarter system, okay? Number 4 is you can't come in and just study the way that you've always studied. It's not about remembering and regurgitating. It's about critically thinking and analyzing the information. Number 5 is you have to be responsible and be an advocate for what kind of learner you are. Like, you have to be able to know yourself before you come in. And then number 6 is professionalism. And that's huge. That's super, super important and key. And each one of those topics that I went over, I'm going to have a series of how to get better at that and how to get ready for starting nursing school. If you haven't started yet and you want to start, get a move on it. Each day is a day for us to come into our potential. I'm proud of you, and if nobody's told you, hello, you're meant to be here and you're meant to do great things. Have a good day. Bye.